Hello, you are most welcome, ladies and gentlemen, to today's tutorial. Now, today we want to look at an introductory bit regarding the study of human anatomy. Now, anatomy is quite complex, but if you have general overview of the whole concept of anatomy, then the study becomes easier, especially for fresh students who will be, studying anatomy. So, without much ado, yes, let's go through the introductory bits, regarding the study of anatomy. Now, one thing that we have to know is that the word anatomy actually comes from the Greek word anatome. And the word anatome, literally means to cut up. And so anatomy will be dealing more with, dissection, cutting part of the body. But essentially, when we are asked to state the definition of anatomy, then we say that anatomy is the study of the structure of some part of the body and the interrelationship of that part of the body with other body parts. And so anatomy deals with structure, shape, morphology, all these things are very important. Size, dimensions of those kind of structures. And where that structure is found, the relationship that is going to have with other parts of the body. So for instance, I'll be telling you that yes, the skeletal system will be related to, the muscular system, or yes, cardiovascular system, and what have you. So all these body systems work in unison to make sure that the individual, actually is sound. And what do I mean by sound? So contrary to the study of anatomy is physiology. Now physiology has to do with function. So if a particular part of the body is actually having normal morphology, yes, normal structure, then it will be able to perform its function effectively. So unlike anatomy, which is physical, which you can actually appreciate, for physiology, you just have to do with the function, the physiology, that the body part is going to perform. So that is one thing that you have to know. So just by way of talking about the interrelationship that other parts of the body have, then what we can see is that, for instance, there's the digestive system. Okay, so then you get to know that the digestive system, will have some muscles which will of course contract and relax to cause the content to move from one part to another. So the muscular system is actually helping the digestive system. On the other hand, yes, the digestive system, after digestion, the nutrients will absorb into the bloodstream, and then they will get to what we call the muscles. So by so doing, that kind of interrelationship among these structures. So for instance, these are the muscles over here. Now these muscles, the muscular system, are also going to get surfaces to attach on what we call the skeletal system. Okay, so the bones, of the skeleton will actually provide surfaces for attachment by these muscles. Okay, by providing these attachment, what happens is that yes, when these muscles also contract and relax, they cause movement of some parts of the skeletal, skeletal system actually. Yes, you can talk about the male reproductive system, the female reproductive system producing, hormones to affect almost all the, various systems that you have. Okay, for instance, the bones, the skin, and what have you. Another way around is that yes, these ones, for instance, the bones, skeleton will actually provide some kind of protection, partial protection to most of these organs in the both male and of course female reproductive systems. When you look at the respiratory system, yes, it has to bring in oxygen rich, oxygenated air which is rich in oxygen, and then take away air which is rich in carbon dioxide. By so doing, the respiratory system is very important to almost all the systems. But of course, this respiratory system will have to be protected with the help of course the skeletal system. Even the various movements that will happen in the thoracic cage, in the diaphragm, there are muscles which are going to help movement in various movements. For instance, if you look at for instance the skin will be very important in actually under the skin we are going to have cholesterol, which will actually synthesize vitamin D, and this vitamin D will help the skeletal system in absorption of calcium. So they are working to help each other. Again, if you look at one of the accessory organs of the digestive system, So digestive being the liver, the liver is going to help in hydrolyzation, as well as the kidneys help in the hydrolyzation of what we call vitamin D, so that it becomes active. Now, of course, the circulatory system, yes, skeletal, digestive system. Let's talk about the skeletal system. By way of the bone marrow, yes, will help in hematopoiesis, production of blood cells, so that at the end of the day, yes, the circulatory system will be endowed with blood cells. On the other hand, too, the circulatory system will give off blood vessels to supply, the skeletal tissue and what have you. So what I'm trying to say is that yes, the waste that the various part of the body will be, generated, will have to be taken out with the help of course, the urinary system. Even the respiratory system will do some. Yes, even the digestive system. Yes, after digestion, yes, the waste will have to come out. The skin will do that by way of the integumentary system. So actually, I will actually go through how we approach the study of anatomy. But for now, you have to know that there are 12 or 11 systems. Now, if there are 12, then what will happen is that we have digestive, muscular system, yes, integumentary, lymphatic system, yes, endocrine system, yes, nervous system. Nervous system is one of the main coordination, systems, which is going to coordinate all the activities of, the various parts, by way of the brain, the spinal cord, the nerves. Okay, the endocrine system is one of those which will produce hormones to affect almost all these systems. But of course, invariably, they will also be getting some kind of, contribution. Okay, the other systems will be contributing to the effectiveness of all these systems. So, for instance, the brain will be protected by the skull. But at the end of the day, yes, the spinal cord will also be protected by the vertebrae, bones of the vertebral column. Yes. So all these are some areas that we have to actually know. Yes, the lymphatic system will have to drain, the excess, lymphatic tissue or fluid, return it to the circulatory system. So these are some bits, as we actually go through all the various systems, we actually appreciate all these things that we are talking about. Now, how do we study anatomy? Now, in studying anatomy, there are some areas that we consider. So, for instance, we look at gross anatomy, which you also call it macroscopic anatomy, or even sometimes we say cadaveric anatomy. Now, what do we mean by this? For gross anatomy or microscopic, then it means that you can see with your naked eye, you can touch, you can actually describe what you see, okay, without the aid of a microscope. Now, with gross anatomy, then we will be interested in either studying these structures in a regional approach or in a systemic approach. If it is regional approach, which I'll be showing you, then we have to study, for instance, the head and neck area, the limbs, upper and lower limbs. Yes, the thorax, the abdomen, pelvis, perineum, yes, gluteal region, the back. These are some areas that we see if you want to study it in a regional approach. Now, for systemic, just like the systems I've mentioned to you, the digestive system, respiratory system, yes, urinary system, and what have you, that's the systemic, approach. Now, even with the gross anatomy, what happens is that, yes, we study the nervous system. Okay, the nervous system. So what happens is that, yes, mainly for anatomy, we say neuroanatomy. So it's a great branch of, the gross anatomy, which we call neuroanatomy, studying, of course, the brain, the spinal cord, of course, the nerves into detail. All these ones will be under neuroanatomy. Now, again, for the gross anatomy, then what happens is that some of the structures that we find in the body, they make some kind of impressions. Okay, we can relate them, on with respect to the skin that overlie these structures, and that is what we call surface anatomy or topographic, anatomy. So having seen gross anatomy, then the next thing that we have to also know is to talk about the microscopic anatomy. That one is, those ones that we can't actually see with our naked eye, and for that matter, we have to be aided with the help of a microscope. Of course, microscope can talk about a light microscope. You can also look at the electron microscope. So if it is, microscopic anatomy, we study the cells, and that is what we call cytology, the study of cells. Now, if you want to study the tissues, then we look at, histology. Now remember, organology, which are the organs, will be under gross anatomy because you can actually see the organs. Okay, so for instance, you can see the liver, you can see the spleen, the kidneys. All these ones will be under gross anatomy. Then there is another area of anatomy which we call it developmental anatomy. Developmental anatomy. And for developmental anatomy, we are interested in actually studying the embryology, okay, the developmental process which will take place in utero, inside the uterus of the mother, and that's embryology. Then, of course, for embryology, we actually look at that one. You see that we have the germinal period, we have the embryonic period, which then we have actually the fetal period. We actually look at all these things, and then even after delivery, what happens is that there will be other changes, there will be other development, there will be other growth which will take place, and that's what we call the postnatal period or postnatal development. Now, usually, if you are trying to study comparative anatomy, if you are trying to study, developmental anatomy, we want to actually compare with other, structures, other, organisms or species of organisms. We want to see if there's some kind of ancestral relationships. Is there any, evolutionary, trend? Is there any similarities or differences between the development? And now when we look at a comparative anatomy, I'll be actually showing you all these things. Then we also have what we call the imaging anatomy, radiographic anatomy, sonographic anatomy. Yes, will be actually be studied. Okay, which are all these ones. Now, if we look at all these things, now the key thing is that we have to actually apply it to the clinical setting. So that, yes, what will be the effect if, let's say, this nerve is injured, or what will be the effect if the structure is injured? And that one is what we call clinical anatomy or applied anatomy. So there we are. If you want to study all these structures that we can actually feel, you can actually see, you can actually describe, see with your naked eye, then we look at what we call gross anatomy. So this is the stomach, you can actually see it. Yes, the pancreas, yes, the duodenum, yes, look at all these, the liver, the gallbladder, which are all part of the digestive tract. So that's what we call gross anatomy. Yes, gross anatomy can look at the brain, but importantly, because this one I'm looking at the brain, then we can actually talk about neuro anatomy. This is actually the ventral aspect of the brain, actually showing more of the brain stem. We'll actually be looking at all these ones. Now, the next one that I told you about was the regional anatomy. And regional anatomy, yes, we study the head and neck area. Yes, we study, of course, the limbs, upper limbs, lower limbs. Okay, in fact, we actually study the thorax, we actually study the abdomen, the pelvis and perineum will be studied. In fact, we study the back, okay, as well as, of course, the gluteal region. So, but important, let me show you some anatomical terms that you have to actually know. Usually when we talk about the head, we say cephalic or cranial, and then if we look at the forehead, we say frontal. The eye has to do with orbital or ocular. Okay, then of course the cheeks, okay, will be called buccals. Okay, the buccal part. And then of course the chin, we will say mental. Okay, yes, by so doing, yes, the ear too, we say otic. So if you hear otic, then we are still talking about the ear. Nasal has to do with the nose, oral has to do with the mouth. Okay, and then of course cervical has to do with the neck. So anytime you hear the word cervical, it has to do with the neck. Okay, labial has to do with the lips. Okay, so these are some areas that we can actually see. Yes, continue with it. Yes, there's the sternal aspect. Okay, the breastbone area. Okay, there's the pectoral region, which is still part of the thorax, that's the chest. Yes, if you look at this, there's the acromial aspect, the acromial process of the scapula. Yes, you look at the acromial area. Yes, the armpit is known as axilla, so that's the axillary region. Yes, where we have the breasts, that's the mama area, so the mammary or the breast area. Yes, of course, the arm will be called brachium. Okay, brachium or brachial has to do with the arm. And then of course in the elbow area, anterior aspect of the elbow area is known as antecubital. And then if you look at this is the abdominal area, where we have the belly button or the navel or umbilicus. Okay, this is the area of the groin, that's the inguinal area. Okay, and then the hip area is known as coxal. Okay, hip area is known as coxal. And then, the forearm is known because it comes before the arm. So forearm is known as, antebrachium or antebrachial area. Then the rest is known as the carpus. So anytime you hear the word carpal, it has to do with the rest. The palmar aspects, okay, and of the hand. Then the digates or digity, if you hear these ones. Then of course, the genitals, has to do, the reproductive organs. Then of course, talk about patella. That's the anterior aspect of the of the knee area. Okay, and then of course, if we talk about the coxal, if we talk about the crural, that's the leg area. Actually, the anterior aspect of the leg area, that's crural. And then of course, the tarsus, okay, will be the ankle area. Okay, tarsus. And then of course, digiti, of course, you talk about pedal, has to do with the foot. So similarly, as we saw, there's actually a posterior view. Yes, you can see still the occipital area. Okay, you can see still the acromial area. Yes, there's the backbone or the vertebral column or the spinal column or the spine, but I've told you that it's never the spinal cord. Then there's the brachium, as we see posterior aspect of the brachium. Yeah, there's the back, okay, or the dorsal aspect of the torso of the body. And then this is actually the cubital, okay. That's the elbow area, okay. That's the cubital area, posterior aspect of the cubital. Okay, now remember that anterior aspect we call it, the antecubital, okay. And then, it's actually the anterior aspect that we call a cubital. Now the posterior aspect is called antecubital, so it's rather being changed. Okay, the posterior aspect is actually called antecubital. Then there's the lumbar area, there's the sacral region, yes, there's the gluteal region, there's the perineum, the region in between the thighs, okay, where we have the external genitalia, and of course the anal opening will be there. This is the femoral, has to do with the thigh, okay. Of course, there's the popliteal fossa, or the popliteal area, that's the posterior aspect of the kneecap, okay, you find that one. And this one is the sural, that's the calf, posterior aspect of the leg. Of course, the crural, of course. The underside of the foot where we walk is known as the plantar aspect of the foot. So these are some areas which you have to know, and they are going to be very important, for regional anatomy and for that matter surface anatomy, so that the structures which are related there, the dermatomes, the nerves supplied to these areas, which can actually help you, especially when we talk about visceral referred pain and what have you. Now, talking about regional anatomy, then it's very important that the structures which are related to some part of the body. For instance, if you look at this, the abdomen, the abdomen can be divided into 4 quadrants or 9 regions. Okay, we actually look at all these things. So you have to know that in the right upper quadrant, what are the structures which you are going to see there. Of course, the liver, right lobe of the liver, of course, you look at, the gallbladder, yes, the right kidney, portions of the stomach, and of course, large and small intestine, some portions will be here. Left upper quadrant, you have to know all these ones. If you look at the right lower quadrant, yes, cecum, vermiform appendix, yes, some portion of the small intestine, yes, reproductive organs, yes, spermatic cord, and what have you will be there. So it means that for instance, if I know the structures which, for instance, in the left lower quadrant, I know that more of the ileum, yes, or the small intestine, yes, will be there, as well as of course the jejunum. Then I know that if there is any problem with the patient is feeling some pain over here, if there's any abscess, if there is any, let's say, root, any swelling over here, and I can palpate it, then I can relate it to the organ that overlies the skin. And that's very important in surface anatomy. So as a clinician, it's very important that you know your surface anatomy very well to help in some form of diagnosis. Yes, I've already told you that, yes, if you want to study anatomy with respect to systems, so for instance, this is the nervous system, okay, talking about the brain, the spinal cord, the associated nerves, cranial nerves, spinal nerves, yes, all these ones will be under the systemic approach. If, for instance, if you look at the endocrine system, talking about the hypothalamus, talking about the pituitary gland, the pineal gland, yes, parathyroid, thyroid hormones, and what have you, yes, all these ones, for instance, the gonads, the testes in males, ovary in females, they will be producing some hormones. For instance, the endocrine portion of the pancreas, being the island of Langerhans, will be actually very important as far as when we are studying, the endocrine system is concerned. And of course, talking about, of course, the circulatory system, actually the cardiovascular system. Yes, I mean, you look at the superior vena cava, all with the heart, the blood vessels, blood that goes through them. So we'll be looking at all these ones. That is, if you want to study anatomy this way, then that's a systematic approach, or systemic approach actually. Then I also talked about, so all these things that I've made mention are actually gross anatomy. Now for the microscopic anatomy, those ones we can't see with our naked eye, so we need a microscope to aid us. Okay, so that if we want to actually study the cell, okay, know what is happening inside the cell, then it has to do with what we call cytology. Then if it's tissue, then we have to, for instance, if there's the organ liver, if I take a section, go through the staining protocol, then I'm able to see all those, microscopic, structures, and that is microscopic anatomy. Okay, by so doing, usually you have to go through some staining protocol. So where the need arises, I'll be taking you through those kind of staining, connective tissue staining and what have you. We'll actually be going through all these ones. Now the next one that we actually be interested in, yes, I've already talked to you about, is developmental anatomy. Now for developmental anatomy, yes, we want to actually go through the developmental stages. Now I told you that for developmental anatomy there are two areas that we look at. We look at the embryonic aspect, that's embryology. Okay, the developmental stages, that of course the totipotent zygote will go through to become a full-blown fetus, ready to survive out of the uterus. Okay, so that this whole process that we are going to go through, yes, I'll be taking you through the embryology pretty soon. That is what we call embryology. Now of course, after you are delivered, of course, the cartilages, most of your skeletal tissue will be essentially cartilage in nature. Yes, we wouldn't have enough strong bones and what have you. There will be other reshaping and other development taking place, increasing in size of several structures. And that one is what we call the postnatal development. Now, I've told you that if you are looking at developmental anatomy, then it's very important that we look at what we call comparative anatomy. Now, with comparative anatomy, we want to actually, study those structures of different, species of organisms. Okay, so that we can actually appreciate, the adaptive changes they have, gone through, in the course of actually evolution, okay, from common ancestor. So actually can actually see that, yes, so look at this one. For the early embryonic period of fish, you can see fish, that of salamander, which is this this is actually an ostriches, it could be a conrictus actually, but an ostrich is a fish. Now this is salamander, which is actually an amphibian. If you look at there's a tortoise, this is actually chicken, fowl. Then we actually, this is actually for human. So you can see that for the early embryonic period, they resemble, okay, they have gill slits, they all have similar structure, similar organization, they all have this tail, okay. And then as time goes on, what happens is that there will be what we call bud development. So both the forelimb and of course the hind limb, which will eventually be developed into what we call the lower limb and of course upper limb, or forelimb and of course hind limb. So these are how the things are going to happen. But at the end of the day, when they fully mature, you realize that this is how the fish will look like: salamander, tortoise, chicken and human. They have similar kind of organization, so to speak. So if you are studying this, then this is what we call comparative anatomy. Now, if you are trying to study comparative anatomy, then it's very important that we know that some structures will actually be homologous. Okay, for instance, you know that the limbs will be coming, okay, this way. So their limbs will actually be homologous, in the sense that they are actually developing from a common, ancestral origin, from a common origin, so to speak. But at the end of the day, essentially, they tend not to perform essentially the same function. So the limbs of, fishes, the limbs of course, salamander, that of tortoise, chicken, and of course humans are going to perform virtually, different functions, so to speak. But of course, again, you realize that after they have been delivered, they will tend to dwell in different habitats, so to speak. And that is when we talk about what we call divergent evolution. So comparative anatomy is very important so that we can appreciate what we call divergent evolution. because essentially they are having a common ancestral origin. Okay, so for in divergent evolution, then we'll be interested in knowing that, yes, for instance, we can see the limbs of, let's say a frog, okay, or a toad will be pentadactyl, so to speak. It will be pentadactyl, having four parts. If you talk about that of other organisms, yes, they will be actually pentadactyl. For instance, if you take lizard, yes, it will be pentadactyl. For instance, humans also have pentadactyl limbs. If that is the case, then it means that, yes, there's that kind of the structures, these limbs are going to be homologous, Now sometimes too, there could be development from different ancestral origins altogether, but essentially they will tend to have structures which perform virtually the same function. So for instance, birds and then insects, have different ancestral origins altogether, but at the end of the day, what will happen is that they will both have they will both have wings, and these wings will actually be useful for flight. And of course, so these structures by way of the wings will be called analogous structures. Why? Because they were developed from different ancestral origins but virtually performing the same function. Okay, that is what we say they are analogous structures. If we have such a thing, then it means there's some kind of convergent evolution that we are actually seeing. Convergent evolution. Now, all these relationships, among different groups of organisms and their evolutionary development is what we actually call phylogeny. Okay, so it's one thing that we have to actually know. But remember, usually we credit the father of comparative anatomy to what we call Aristotle. So there we are now. So we've seen, yes, gross anatomy, we've seen microscopic anatomy, we've seen developmental anatomy. Then we also have imaging anatomy. So for imaging anatomy, for instance, there's an ultrasonography, okay, ultrasound scan that we are taking for a woman in sices, okay, who is in a state of pregnancy. Okay, so we take the scan, okay, and that is what ultrasonography does. So we can actually relate the organs in there with the image that we actually see, okay, to predict the which time of the month or which trimester the embryo or the fetus is in. Okay, so that is an important bit that we have to actually know. By so doing this ultrasound scan, yes, there's the abdomen pelvic scan that we are taking. We can also actually identify disorders, that perhaps the fetus is going through, or even some other organs inside, for instance, the kidney, urinary bladder, the liver. If there's any problem with it, then ultrasound scan can actually see. Then, with the imaging, yes, apart from ultrasonography, then what happens is that we also have what we call radiology or radiography actually, and that one we study images, okay, which we capture using X-ray or electromagnetic waves. So there's actually computed or computerized tomography. Okay, this is actually tomography which we've taken. Now you realize that this one will be very important because it gives more detail. For instance, this one is actually showing us the brain. So if we're able to, so for instance, that of the one that we look for when we are looking at the brain, yes, it's actually what we call the CT scan. CT scan can actually give more detail than the ordinary X-ray, so to speak. Okay, so it can actually help to know if a patient is having some kind of stroke. Is it an ischemic stroke or is it hemorrhagic? It can actually reveal all these things. Can see all those ventricles and what have you. So that's actually imaging anatomy. So by way of trying to actually stress on the imaging anatomy, as far as radiography is concerned, what happens is that, yes, we have a radiographer as well as a radiologist. For a radiographer, yes, radiographer will be concerned with operating the medical imaging equipment, okay, and of course they will actually capture these kind of images. And then the radiologist, okay, will be very important in interpreting the images which are being captured. Okay, that is an important thing that we have to know. So for instance, there's an image of the thoracic area, and we can actually see that in the lungs there's some kind of pneumonia. Okay, and that kind of interpretation by radiologists will actually be augmented of late by what you call artificial intelligence. Artificial intelligence nowadays helps in reducing the turnaround time and what have you. So in future we will actually be looking at some radiologic images as well. So if you look at radiology, I mean these ones, yes, we can actually help you to know the official, whether the official plate has fused or hasn't fused. Actually help in knowing the ossification centers. You can actually see there's actually the clavicle. You can see all those structures. We actually go through the principles in our later sections. Now, importantly, yes, studying anatomy is very important for you to appreciate your directionals. Okay, directional terms are very important. So for instance, as we get closer to the head area, okay, as we get closer to the head area, we say we are going cranially or we are going superiorly. Okay, and as you come towards the leg area, we are saying you are going caudally, okay, or you are going inferiorly. Okay, these are the things that you have to know. Now again, if you look at this, the ventral part of the body, okay, is known as the anterior portion. That's where the belly is. Okay, front part of the body is known as anterior or ventral. Then the back side is known as dorsal or posterior part. Okay, dorsal or posterior part. We have to actually know these ones. Again, if you look at the laterality, okay, what happens is that if you take the midline of the body, if you take an imaginary line through the midline of the body, what happens is that this is the left part of the body and this is the right part of the body. Okay, now if you look at that structure, which actually those structures will go through the midline of the body, are known as median structures. Median structures. Okay, median structures will be going through the midline of the body. Now if you are closer to the midline of the body, then we say you are medial. So for instance, you can see that the lips over here, as well as the nasal septum over here, are median structures. Okay, so for instance, you can talk about the labial tubercle. Okay, the tubercle over here, yes, will be actually median structure. And then we can say that the eye is actually medial, okay, because it is quite closer to the middle of the body than the ears. Okay, so the ears will be further away from the middle of the body than the eye. So we say the ears are lateral. So we can say that the ear or the right ear is lateral to the right eye. In the same way, we can say that the right eye is more medial or is medial to the right ear. Now apart from that, there are some structures with respect to a reference point. There are some structures which are more closer to a reference point, and there are some structures which are away from a reference point. If we say you are more closer, then we say you are proximal. Okay, then if you are further away from a reference point, then we say you are distal. Yes, sometimes we can use superior and inferior for it, but usually with respect to the limbs, both upper and lower limbs, it is better for us to use proximal and distal instead of using superior and inferior. Okay, so that is one thing that you have to know. Okay, so of course the same way, proximal, distal. Okay, so that's one thing. These are directional terms which are very important. Now, having seen laterality, then one thing too is that you have to know is that if it's just a single part of the body, which we are single side of the body that we are interested in, then we say is unilateral. Unilateral. Uni means what? If it is both sides of the body, then we say bilateral. Bilateral on either side. Now, if we are looking at two structures which are both on the same side of the body, so for instance, this is the right upper limb, this is the right lower limb, then we say they are ipsilateral, the same side of the body, ipsilateral. So for instance, I can say that yes, the right lung and the right kidney are ipsilateral because they are found the same side of the body, ipsilateral. If they are talking about two structures and they are found on opposite sides of the body, then we say they are contralateral. They are contralateral. So for instance, yes, the left upper limb and then the right lower limb are contralateral structures. Contralateral structures. So these are some things that we have to know. So for instance, I can say that the left kidney is contralateral to what we call the liver, because the liver is more to the right, side of the body. Now sometimes too, yes, we can combine some terms. So for instance, we know that yes, this is a bit superior, this is a bit inferior, this is at the upper level than this one. So we can say superomedial, and it's more medial actually to this. This one is closer to the midline of the body, this one is further away, but this one is at a lower level. So we can say it is inferolateral. So if it is going this way, then we can say it is inferomedial, okay, to this point. The same way, if it's posterior and superior, then we can say this one, is going posteriorly, okay, to the back side, but going upward. So we say posterior superior. But this portion, where is the knee cap, is actually anterior as the front part of the body, and it's at a lower level than this part. So we say antero inferior. So these are some combination of terms. So if you hear superomedial, it means that structure is superior and it's also medial. If you say inferolateral, it means it's inferior and as well as being lateral. If it's posterior superior, posterior and superior, and anterior inferior, anterior and inferior. So these are some important bits that you have to actually know. Now, if you are having some kind of internal organs or external structures, actually I'm interested in the hollow organs. Then one thing that you have to know is that if it's a hollow organ, for instance, if it's the heart, if it is the stomach, if it is the small intestine, if they are the blood vessels, which are hollow organs, then we can say there are some structures which will be external, more outside, and there will be some structures which will be internal, more inside. Okay, so if you have that structure, there will be a lumen, and if it is more closer to the lumen, we say it's internal. It's further away from the lumen, we say it's external. But for some other structures, okay, for instance, if you look at the skin, or let me say for solid structures, okay, then what will happen is that we'll be interested in saying that this structure is actually deep, this one is superficial to this one. Now if you are superficial, it means you are more closer to the skin. If you are deep, then you are further away from the skin. So for instance, you can take the thorax region. You can say that the rib cage is superficial to the heart, because the rib cage is more closer to the skin than the heart. But we can say that the heart is deep to the rib cage. So these are some things that we can actually talk about. Okay, deep and superficial. Okay, so by way of talking about the skin, let me just show you briefly. Yes, the skin. Below the skin there will be a layer of superficial fascia. I will actually go through all this one. This is actually the abdomen. Yes, camper fascia, scarpous fascia, membranous scarpous fascia. Then of course you are going to have those kind of trilaminar layer of muscles, external oblique, with their associated fascia, which we call them we are going to have with their aponeurosis, and then of course associated fascia, extraperitoneal fat layer, parietal peritoneum, yes, of course, visceral peritoneum, yes, then you enter the peritoneal cavity proper. You actually look at the abdomen, look at it. But I'm interested in telling you that if we say a structure is superficial, it's more closer to the skin. So if a structure is more closer to the skin, so we can say that this superficial fascia is actually superficial, as the name suggests, to what we call the trilaminar layer of muscles. Okay, the trilaminar layer of muscles are actually deep. Now again, it's very important that we learn the plane of sections that the body we can actually divide, and they are going to be very important in description. So for instance, if you take a section through the midline of the body, then we say that is what we call a mid-sagittal section, or that is a median plane through the midline of the body. So that superior inferiorly, okay, through the midline of the body, superior inferiorly, so that you are able to divide the body into two equal halves, okay, right half and left half. That is what we call mid-sagittal plane or median plane. Now any plane which will be parallel, okay, running parallel, okay, also superior inferiorly, okay, to the median plane is known as parasagittal plane. That one is not running through the midline. So if I cut it this way, it's not running through the midline. So we say parasagittal plane. Okay. Now the next one, so it means that, yes, as I said, the mid-sagittal plane will divide the body into left and right halves. But parasagittal plane will divide the body into left and right parts. Okay, not necessarily into halves. Now, if it's a transverse section or transverse plane, then that kind of imaginary line, okay, that goes through the body, and from lateral, okay, to lateral, or from left side to right side, or vice versa. Then what happens is that you're able to divide the body into an upper portion, a superior portion, and a lower portion, that's the inferior portion. Okay, so dividing the body into upper and lower part, or superior and inferior part, is by the canonical of what we call transverse plane. This transverse plane can also be called horizontal plane. Now if I take the section, okay, if I go through, yes, the same superior inferior section, but this time around I'm dividing the body into an anterior portion or ventral portion and a posterior portion or a dorsal portion. That is what we call coronal section. Coronal section. Now this coronal section can also be called frontal plane or frontal section. Now any other plane apart from these three that we've seen, okay, running obliquely, is known as oblique plane. Okay, oblique plane. So that is one thing that we have to actually know. Okay, so the sagittal plane, okay, this frontal plane, if you divide it this way, halfway this way, and then of course the transverse plane running this way. All right. Now it's very important that in the study of anatomy we actually know how we describe the various parts of the body. So sometimes I'll be saying it's lateral, it's medial, posterolateral. Now how do we actually know this? We know this because we have a common description approach, which is universally accepted. So every anatomist uses it, and that is what we call the anatomical position. Anatomical position. So this is the anatomical position, which is an important reference point, okay, for observing every structure, okay, in the body, so that you can have a common descriptive purpose. Okay, and this anatomical position, yes, you can see that the subject stands erect. Okay, you have to stand erect, upright, and then you face the observer. So assuming I'm the one looking at it, I'm the observer. You face the observer with the head level, eyes facing forward. So the eyes should face forward. You don't have to bend your head. Again, what happens is that your arms should be by your side. Actually, the palms should turn anteriorly. So the palmar aspect of your hand should face anteriorly. Okay, and then of course the lower limbs also by the side. Okay, but importantly the toes actually pointing forwards with the feet, both feet, to the floor or to the ground. That is what we call the anatomical position. Anatomical position. However, yes, there could be other positions which are of importance. Yes, some patients may be in different positions at different times. So especially for health workers, you have to know these positions. And this position is supine. Now for supine, yes, you lie on your spine, so to speak, supine. Okay, so that what happens is that you lie on your back, so that your ventral portion or the anterior portion actually faces upwards. Okay, that's the supine position. So in the bed, in the hospital bed, most patients lie supine. Now this one is prone, in prone position. So for prone position, what happens is that you lie, yes, on your ventral aspect, so that your spine actually faces upwards. Okay, that's the prone position. Now the word recumbent, okay, is to lie on your side. Sorry, is to lie, actually lie down. Okay, now if it is lateral recumbent, then it means to lie on your lateral aspect. Then it could be dorsal recumbent, means to lie on your back. So if it is right lateral recumbent, it means you are lying down on your right side. Okay, lying down on your right side. Then if it is left lateral recumbent, you are lying down on your left side. But if it is dorsal recumbent, okay, dorsal recumbent, you are lying on your back. And this one is actually going to be very important for obstetrical examinations. Okay, for dorsal recumbent, yes, of course, repair of lesions around the perineal area after surgery. Okay, also for vaginal examination, patient will have to lie in dorsal recumbent. Now we also have what we call Fowler's, position. Now for Fowler's position, the patient, will actually be seated in a semi-sitting position, having the knees, okay, these are the knees will have to be, actually extended, okay, it will be straight, or sometimes it could be bent, okay, could be bent as well. Now the angle over here, how the position will be, patient will be positioned in Fowler's position depends on the condition of the patient. So for instance, if the patient is having, some kind of respiratory problem, having difficulty in breathing, then what happens is that the patient will have to be placed in a high Fowler's position, roughly 60 to 90 degrees. Then we also have what we call Trendelenburg position. You can also have this Trendelenburg position, which can see how the patient actually has lied, so that there's a slant angle, so to speak. Okay, the head is more or less, the leg is a bit at a higher level than the head. And this one, usually, if let's say a patient is unconscious and will need more blood to get to the brain, then of course this one, Trendelenburg position, will be very ideal. Okay, so if I send a patient to a hospital, the patient shouldn't, unconscious, shouldn't be seated in the car. If the patient is unconscious, actually, then what happens is that, yes, has fainted, the person will have to be in a Trendelenburg position, so that actually the limbs are actually at a higher level than the head, so that more blood can get to the brain. So there we are. Yes, in the hospital bed, supine position. Yes, prone position, dorsal recumbent position. Yes, this one is very important, lithotomy. So for lithotomy position is very important during childbirth, also during gynecological examination. Now what happens is that in lithotomy, yes, the patient will lie on the back with the knee flexed. Okay, you have to flex the knee. You have to actually flex the knee. Okay, and sometimes you can actually pat the foot. Okay, you can actually pat the foot. Okay, and the foot are raised. That is lithotomy position, very important during child delivery. Now other ones which are important, yes, we can actually see Sims. We can actually Sims position. So for Sims position, we also call it lateral position. We also call it lateral position. Now in this position, look at it carefully. The patient lies on the left side. Okay, lying on the left side with the thigh slightly flexed. Okay, actually with the left thigh. Okay, this is the left thigh slightly flexed. Okay, but what happens is that the right thigh is more flexed, so it's acutely flexed. The right thigh is actually acutely flexed on the abdomen. Okay, flexed on the abdomen. Now what happens is that the left arm, okay, this one actually lies behind the body. Okay, with the body actually inclined forward. Okay, incline the body forward. Now this Sims test will be very important for what we call rectal examination. If you want to examine your rectum, so if you want to administer enemas, can also go through this way, as well as if you want to actually examine vaginal wall prolapse. That is the position that the patient will have to be in. Well, this one is known as the knee chest position. So as you can see, yes, the knees on the bed with the head pointing downwards, the posterior aspect of the body actually facing upwards. There's the gluteal area, the perineum also be there. Now this one is very important for also gynecological examination, as well as lumbar spine surgery. So gynecological surgery or lumbar spine surgery, very important. So other things that you can see is the standing position, yes, sitting position, the squatting position. So these are some positions that you have to know, especially if you're a health worker, nurse, clinician, what have you. You have to actually have fair idea of these ones. Now there are some specific movements, yes, that we can see done by what we call the forearm. So we can actually see this one. This one is known as, yes, supination. So if I want to go through supination, then what happens is that the palmar aspects, okay, of the hand will face upwards. That's the supine position. and it's done by, of course, the supinator as well as the biceps brachii muscle helping in supination. Now the opposite of supination, where the radius actually rotates and lies over the ulna, is known as pronation. So in pronation, yes, apart from using the pronator teres, and the pronator quadratus also takes part. Okay, so these are some movements. Now other important movement which you have to actually know, yes, so you look at this, the midline of the body. If you take the upper limb away from midline of the body, or any other place away from midline of the body, then we say it's abduction. If you take it closer to the midline of the body, we say adduction. You added it, right? So these are some kind of movements that you can actually see. Again, we can see medial rotation. I'll actually show you a better view. Medial rotation coming to the midline of the body, lateral rotation moving away. Again, we can also have this, the neutral position. If you move it this way, you've actually flexed it. If you go this way, you've actually extended. Okay, extended the knee, the hip joint. Okay, so I've actually flexed the hip joint. If I go this way, I've extended it. Yes, we can look at elevation, protruding a certain part upwards, depression coming downwards. Yes, of course, the same extension and flexion that we've seen. Yes, this the normal position, you've extended it. Yes, this the flex position, you reduce the angle at the neck area. Okay, and then of course for flexion and extension, so if you go this way, yes, this extension, okay, closing the angle of the forearm. Yes, if you extend it further, increase the angle, that is what we call extension. Now for the hand too, we can do what we call extension, okay, and flexion. Now the flexion is actually known as the palmar flexion, and if you extend, we call it dorsiflexion. Okay, so the same way that we saw, yes, supination, yes, of the hand, and then so this is the supine position, the palmar aspect faces upwards, pronation, the dorsal aspect is faces upwards. So as we can see, yes, you can see all these things. I'll actually show you this one. Now there's eversion and inversion. So for inversion, the medial aspect of the foot actually is raised and it turns inwards, and then for eversion, the lateral aspect is raised and it actually turns outwards or externally. Okay, the same way for the foot, we can actually have the flexion of the foot, which we call plantar flexion, and extension of the foot known as dorsiflexion. Okay, so these are some bits that you have to actually know through the inversion, plantar flexion, as you can actually see. So flexion, you are actually decreasing the angle. Extension, you are increasing the angle. This is medial rotation, coming closer to the midline of the body, rotating it, the shoulder joint closer to the midline of the body. Lateral rotation, opposite, moving away from midline of the body. Now if I go through adduction, bringing it towards the midline of the body. Abduction, taking it away from the midline of the body. And then of course, if you go through all these movements so that the base forms something like a cone, then we call it circumduction. Yes, with the legates, there are some important movement that I have to explain. Now, although we talk about abduction, that taking it away from midline of the body, for the hand, the midline is actually the third legate. The midline, where the force, the action of force happen, is known as the third legate. And so if you take the legate away from the third legate, where is the midline of the hand, of the fingers, is known as abduction. If you take them closer to the third legate, it's known as adduction. For the toes is different. If you say abduction, then it's with respect, this time right, with respect to the second legate, second toe. So that if you take it abduction, taking all the legate away from the second toe, abduction, that's the midline portion. Then if you take the legate closer to the second toe, we say adduction. So these are some dynamics that you have to actually know. Again, if you look at the legates, flex, there's a flex toe, flex legate, thumb. Okay, there's flexion. Okay, you've reduced the angle, but if you extend it, you've increased the angle, extension of the great toe. Then you have what you call abduction, taking it away from the body, actually from the rest of the legates. Okay, abduction, actually taking it away from legate 3. But if you get it closer, we say adduction. Then we can have opposition movement of the thumb, Okay, you can move this way. That's the opposition movement of the thumb. Now if I take it away by not opposing, okay, the thumb, then that is what we call reposition. Now, importantly for anatomy, knowing the various movement, other things that you have to know is the body cavities. Okay, there are two main body cavities, and these body cavities are the ventral body cavities. Those ones are related to the front part of the body, and the dorsal body cavity, related to the back side of the body. For the ventral body cavities, we have the thoracic cavity, which is separated from the lower cavity, which is known as the abdominal cavity, by the diaphragm. Okay, which is known as, yeah, there's the abdominal cavity, thoracic cavity, the diaphragm separating them. Then below, okay, the abdominal cavity, which actually continues with this cavity, is known as the pelvic cavity. Okay, now even when you look at the thoracic cavity, what happens is that we are going to have what you call the mediastinum portion. Okay, there's actually the superior mediastinum. We are going to have the middle mediastinum. Actually, we have anterior and posterior as well. And the middle mediastinum in the pericardial cavity, okay, will be invested by the heart. The pleural cavity will be invested by what we call the lungs. Remember, it is not the cavity that these organs are dwelling, but they actually push through it. Okay, so there's just a potential space where you can have some serous fluid actually going through it. Then again, we also going to have what we call peritoneal cavity, where we have what we call the intraperitoneal organs also investing in it. They are not actually in the cavity itself. Okay, so that is one thing that we have to actually know. So you have to actually know some organs which you are going to have in the thoracic cavity. The heart, the lungs, the thymus. They will be in the thoracic cavity. Then of course in the abdominal cavity, yeah, talk about the gastrointestinal organs. Yes, in the pelvic cavity, the urinary structures, as well as the some caudal portion of the digestive system, as well as of course the male and female reproductive structures. They also have the dorsal body cavities. The dorsal body cavities, we are going to have the cranial cavity, which of course the brain will dwell there. Then we're going to have what we call the vertebral canal. Okay, the vertebral canal or the vertebral cavity, where of course the spinal cord will dwell in. Now we have to actually know some prefaces and suffixes, as well as even emphasis, okay, and as well as some other terms which we often use in anatomy, so that anytime you hear it, then it tells you it has to do with something. You don't need to always memorize. So the word epi has to do with above or on top of something. So of course epidermis, epicranium, and what have you. We will actually be going through all these ones. X means outside, exhalation, expiration, all these ones. Hypo means below, hypodermis, hypotension, hyper means above, hypertension, hyperactivity, all these ones. These are some examples that you have. Im, like immature, impermeable, all these ones. Then in, also similar to im, incurable, imperforable, all these ones are there. Yes, infra has to do with above, infrapatellar, infraspinatus. Yes, infra means above, peri means above. Okay, peri means around actually. So periorbital area, around the eye. Yes, post means after, so postnatal period, postmortem, and what have you. After, pre means before. Okay, which is the same as pro, means before, prognosis, foreknowing, all these things are some areas. Okay, then super means above, like superciliary arch. Okay, you can have supra is the same as above anyway, like suprapubic area, like supraspinatus, all these, and sim, has to do with, together, which is the same as, sin. For instance, if you talk about the pubic symphysis, okay, fusing, the anterior aspect, the two oscars, they together anteriorly. Sin means fused, synarthrosis and what have you, fused together. Synostotic, you actually go through this. Trans means crossing, or through. So we actually transinguinal, trans, umbilical. Yes, all these are areas that you have to know. Yes, and yes, not or without. Yes, ante, before. Yes, atro means joint arthrosis. Atro, yes, plaque. You actually be seeing all these. The word cardio or cardia has to do with the heart. Site or cyto has to do with cell. Derma or dem, has to do with skin. Ectome, ectomy, has to do with surgical removal, or for instance, gastrectomy, entero, has to do with intestine, gastro, stomach, hemi means half, hemi section, used to has to do with tissue, area, has to be referring to superior, itis, inferior, okay, infection, itis has to do with inflammation actually. So hepatitis, inflammation of, so asia, has to do with lasia, has to do with, word, okay, neuro, nerve, logi has to do with study of something. Oresia has to do with appetite, for instance, anorexia, anorexia nervosa, anorexia bulimia, all these ones. When we look at all those disorders, we actually see them. Osteo has to do with bone. Otomy has to do with the cutting, that's why we talk about anatomy, has to do with cutting. For instance, gastrectomy, you're going to cut the stomach away. Zomia, oxygen, of course, we are hypoxemia, reduce oxygen, hypoxia, all those ones, right? So para has to do with near, so we can have para, nephric fat, around or near, the fat, peri means around, so para has to do with around or parallel to it. Poly means many, poster, behind, so posterior. So if you look at posterior, has to do with behind. Hospi, colonoscopy, okay. Ventral, that's the ventral aspect, the belly aspect. So these are some kind of areas that you have to actually know, all signifying, ortho has to do with self, quad, has to do with tail region, cephalic has to do with head, cranial has to do with the skull, dactyl has to do with fingers, that to pass through, this, has to do with distant, yes, dorsal has to do with back, this abnormal, yes, emia, yes, has to do with, so if you look at, dorsal has to do with the back, this has to do with abnormal, emia has to do with blood. So for instance, anemia, we have reduced blood or blood cells. Erythro has to do with red, so for erythrocyte, red cell. Aesthesia, has to do with the nerve, paresthesia. We actually be seeing all these ones. Then hypo means below, as we've said. Yes, ache has to do with pertaining to something. Laryngo, has to do with the voice box. Okay. Then leuco is white, so that's why we have leukocytes, white cell. Lobe has to do with the brain. So for lobectomy, you can remove some part of the brain, which is effective. Osis or otomy. Okay, osis, yes, abnormal condition. Otomy, to cut up, peri, which has to do with around, we've seen it already. Phlebo has to do with the vein. So for us, a phlebectomy, phlebotomy have to be, taking blood from a vein. Pelagic, has to do with paralysis, paraplegia, sclerosis has to do with hardening. So you can have multiple sclerosis, yes. Scoli, has to do with bent. Thermi has to do with, heat. Thermal has to do with the heat. Yes, other ones that we have, algia has to do with pain, sight, like kill, like suicide. Mia has to do with blood, as you've seen, gram, unit of recording, graph, the instrument, which, so mammography, we have record, the mammary, the breast, features. Then itis has to do with inflammation, as you said, ology studying, tumor, it has to do with oma, oria has to do with flu, like menorrhea, hypermenorrhea, okay. Yes, malacia, yes, has to do with soft. So malacia is opposite to, sclerosis, okay. Phasia has to do with speech, phobia has to do with fear, okay. So all these ones, yes, you can see those kind of examples like arachnophobia, fear of spiders, yes, dysphagia, your difficulty to speak, osteomalacia, yes, softening of bone, menorrhea, yes, reduced flow of blood, yes, lymphoma, blood, cancer, tumor to the, lymphocyte in the blood, lymphatic system, or to the blood actually. Ophthalmology, yes, studying the eye, yes, appendicitis, yes, inflammation of the appendix, electrocardiograph, studying the heart, electrocardiogram, all these ones, cholesterol, a lot of cholesterol in your blood, germicide, and of course, neuralgia, nostalgia, pain of the bone, Now, there are other things too that we have to actually know. That there are some names which, we know the anatomical name, but sometimes we mention the eponyms. Eponymous part of the name. And these eponyms, are actually names which are given to some structures named after people, especially those who discovered them. So, for instance, if you look at, Achilles flex, or that's a plantar flex, okay, if you say Achilles flex, because Achilles tendon, is holding the superficial, connecting the superficial, muscles of the posterior aspect of the leg to the calcaneal bone. What happens is that if you say, the posterior aspect of the leg are going to help in what we call, plantar flexion. So it means that Achilles flex has to do with plantar flexion. Then Achilles tendon, yes, is the calcaneal tendon, as we've said. Adam's apple is a thyroid cartilage, okay. Ampulla ovata, okay, is the hepatopancreatic ampulla. We'll be looking at all these ones. The aqueduct of Sylvius is the cerebral aqueduct, yes. Orbex plexus, that's the myenteric plexus. In between, of course, the inner circular and outer longitudinal, muscle layers. When you look at the gastrointestinal tract, Bartholin's gland, that's the greater vestibular gland, yes. Bowman's capsule is the glomerular capsule, okay. Broca's area, that's area 44, and areas 44 of the Brodmann's area, that's the speech area, that's the Broca's area, okay. The Brannus glands, okay, that's the submucosal glands of the duodenal or the duodenal glands proper. Yes, the bundle of His, that's the atrioventricular bundle. The canal of Slemch, okay, is the sclera venous sinus. Then circle of Willis, okay, that's the cerebral arterial circle, the arterial supply to the cerebrum, okay. We look at all these ones. Corpus glans, that's the bulbo urethral gland, okay. So if you hear corpus gland, it's the same as bulbo urethral gland. Crypts of Lieberkühn, that's the intestinal crypts, okay. Where the small intestine, large intestine, the mucosal glands over there are known as crypts of Lieberkühn. Yes, the accessory gland of the pancreas is known as, yes, duct of Santorini, as we've seen. Yes, the main pancreatic duct is known as duct of Wilson. The Eustachian tube is the pharyngotympanic tube, and that is also known as, yes, the auditory tube. Fallopian tube is the uterine tube or the Salpings. Then fissure of Ronaldo, yes, is the central sulcus, okay, of the brain. We will look at all these ones. Then fissure of Sylvius, that's the lateral cerebral, sulcus. The Graafian follicle, that's the vesicular ovarian, follicle, okay. So these are, or the mature follicle or the tertiary follicle actually. The Graves' disease, that's hyperthyroidism. Herbacean canal, that's central canal, yes, herbacean system, the respiration, the osteon. And then of course we also have the Heimlich, maneuver, that's the abdominal thrust maneuver. We will actually be seeing all these ones. So that is essentially, some bit of, introduction that we have to know. Now in future, I'll be actually going through the history of anatomy. But I want to end with this. As students, as you want to actually study anatomy, it's very important that you study anatomy in a systematic approach. Okay, study it step by step. You don't just jump anywhere and do it. Study it step by step. Pay attention to the morphology. Look at the size, look at the shape. Yeah, look at the relations around it. Okay, very important. And also actually look at some anatomical variations which you may also see. Very important. You have to read books. Not only do you have to read lecture notes, read books. In fact, attend lectures very frequently, very important, and watch videos like these ones that I'm doing. It's important that when you want to actually learn these ones, you have to use models, look at textbook images, and of course go to the dissection hall to have real feel of those structures. Importantly, for you to actually appreciate concepts, it's very important that, yes, you solve relevant questions that relate to the subject matter, and then importantly, pay absolute attention when you are in class. So with this, I welcome all those students coming from after COVID-19. That is going to be quite stressful, but of course with these kind of things that I'm trying to tell you, it's also very important that you don't have to pile your notes. Please read them all the time, and then have a very important good orientation to whatever you'll be taught in class. So thank you very much, and may God richly bless you.